Today our team is going to see about 80-something patients, and then tomorrow we expect the clinic to be even busier. We've already had a number of interesting cases, a number of very challenging cases. We have a much older lady, one of the original founding members of this community, who has tuberculosis. In order for her to receive treatment from the services here, she would have to make a 4-hour journey once a week down this mountain, which is impossible. So we're working really hard to try and figure out what we can do to help her right now, and to see how we can figure out how to overcome kind of these barriers to get her the care she needs. Certainly being able to access specialist care remotely for her is going to save her a lot of otherwise very difficult and impossible trips down this mountain. Another case that we've had that's actually very serious is a lady in her 40s who is incredibly emaciated, had a previous visit to hospital. It was unclear kind of from the history what had been done. She and the family were very unhappy about how they had been treated, and even after a couple of weeks in hospital, they have no idea, or the patients and the patient's family have no idea what she has, and she was just sent home with, I think, essentially some Tylenol. This is going to be a very challenging case. We're still not sure what's going on with this lady. She may have miliary tuberculosis, she may have some kind of metastatic cancer, or it may be something else entirely. Either way, we're going to go back and look at her again, gather what information we can, and see if we can't kind of rally some specialist advice to find out what our next move should be, because bringing a patient from here to a specialist on the other side of this entire country is a huge, huge undertaking. And when we're going to take somebody, we need to do as much as we can on site first, so that when we go, we don't have to come back again and again and again. We really need to try and make every visit to a specialist count, because here, going to a specialist isn't the same as driving across town. It's crossing an entire country after descending a mountain that has no road. So thank you again for all of your help with all of our cases on Sermo. We've really seen a lot of very tough cases get solved, and we're looking forward to using Sermo, as we continue through the future to try and make advanced specialist care available in places like this.